Good afternoon again. If you didn't catch yesterday's video, let me reintroduce myself. My name is Tim Lovell and I am the senior leader and pastor of the Goodlife community. We realise, as we said yesterday, that we are in uncharted waters, that we are in a situation that has not been experienced, certainly in our lifetime. And we are getting new information all the time, and we are making the most appropriate decisions we can as we go along. And so I want to introduce to you today one of the key resources that we have been in communication with, a health professional named Jay Houston, who is a part of our community. Jay is not just an outside source that we have found or come across. Jay is a part of this community, understands the heart of this community, understands the demographics of this community, and therefore the vulnerability of our community. And so I welcome you, Jay. I thank you first and foremost for the amount of time that you have already shared with us, with our leadership team. And I just want to tell you up front, I appreciate your concern, not just for our community, obviously, but for our state and for our nation. And I thank you for what you have shared, but the reason I asked you if you'd be willing to come into this space with me is so that you can share with our community and those beyond who will probably take a hold of this information. First and foremost, a little bit of your credential, because there is a validity that comes with that.
Sure. So my background is I have my master's in international health, international public health. So a lot of people might not know what that means, but it means that I've had some training in epidemiology, biostatistics, communicable disease control, including what to do if there is an epidemic or a pandemic.
Yeah.
And I've also been working in this field in communicable disease control and public health, predominantly in the Northern Territory, but also across developing nations as well around the world for the last 10 years. And I'm currently in a public health advisory role in two organisations officially, one in Northern Territory, one in Queensland.
Great. So let me ask you some, I guess, fairly baseline sort of questions. We're hearing a lot of different things about coronavirus or COVID-19, and one of those things which seems to be, fairly prominent is that this is basically just another flu. How would you respond to that? And then secondly to that, I guess another part of this is people are saying, well, we've seen other COVID viruses, coronaviruses, go through that we've come through. And so why are we worried about this?
Yeah, I think it's a valid question. It's a good question. So firstly, to answer why, is this just a flu? Well, no, it's not just a flu. It does not have, for starters, it's new. We haven't experienced this disease before. This is more comparable to, if you're going to compare it to a flu, it's more comparable to the Spanish flu in terms of its level of contagiousness mixed with its level of lethality. So from an epidemiological perspective, we haven't seen these kind of stats since then. So it's not just a flu. To not raise, within that doesn't mean that if you have it, you are going to die, obviously. We have to find a balanced approach. On one side, it's just the flu. On the other side, people are thinking, if I get this, I'm going to die. Well, both of those responses aren't right. The balance is in the middle. But what I want to talk about now is why are you seeing, why did we see 760 million people in China locked down to control COVID-19? Why are we seeing Austria put in place no more than 5 people at a time to be meeting? These are extreme measures, and I think that can confuse people because if you look at the stats, you think, well, only 80% of people, 80% of people experience this in a mild way. So, and then out of those people that experience, the 20% of people that experience more severe consequences of this disease, only a small portion of those actually pass away. So I can see how people look at the data and go, oh, my personal risk is so low, I'm not worried. But we have to take a step back and we have to actually look at the broader risk to the community and the implications that follow. And like we've seen happen first in Wuhan and now in Italy and in Spain and in Iran, is that you can have a few cases and that can escalate quite quickly.
Yeah.
And our only measures, because there is not herd immunity, when flu strains come through, certain people in the community get immunity to it, then when it comes through again, they don't contract it, so then they don't pass it on. We don't have that. We also don't have a vaccine. So without any interventions, on average, and this could change, but the R0 factor, which is the reproductive rate of COVID-19, is about 2.5 per person. That's just the estimate at the moment. So if we have somebody here, they come back from California or wherever, Iran, Italy, and they bring COVID-19 into the community unawares to themselves.
Yep.
They then have the capacity to pass it on to 2.5 people. Then they can pass it on. And let's just go with 2, just because, we don't want to draw half people right now.
Yeah.
But very quickly, you can see that there's exponential growth.
Yeah.
So you start with one case and very quickly this expands. What also makes this trickier than, say, SARS is that the incubation period seems to be longer and also asymptomatic.
Yeah.
So when we've had other epidemics or pandemics occur, it's the ability to pass on the illness is reduced by the fact that that the ways of contraction might not be as easily pass onable as this. So
asymptomatic, meaning that they can be carrying this virus, not know it, not be presenting, and then it gets handed on. Yeah. And then once someone becomes symptomatic,
it's already progressed.
Yeah, and so this handing on may have happened before person A even becomes symptomatic.
Yes, that's right. And even, that's the best research at the moment, that we do have this incubation period of about 14 days. Most people will get symptoms between 2 and 5 days, but there are cases where people don't seem to get symptoms for 14 days, but they are still infectious, so they can still pass that on.
So it's unknown what we're facing.
There's so many unknowns, and also, for some people that do get it, because their symptoms are so mild or subclinical, they might not go seek medical care, or even, they'll still go to work, they'll be well enough to still go to work, still go to the gym, still go to concerts, still go to nightclubs, because they don't feel that bad.
Which is the tragedy, really, of what happened here on the coast. Yes. With a traveller who apparently, by all reported information, comes back, gathers with family, spends time together, lady gets sick, she travels, and then...
It hits her a lot harder because with her age, her immune system may not be as working as well as the daughter that visited her, and so then we see a death occur. And that happened quite quickly. Yeah. And so that unfortunately just brings the reality home to us that whilst for you might feel fine and you might want to go about your daily life, what we're doing unintentionally, because that's been our culture. If we feel a little bit under the weather, we soldier on. We soldier on, we battle on, but actually at this point of time, we actually need to change that culture and not soldier on and protect those around us if we are sick. Because it leads me to the next point, is that because we don't have herd immunity, because we don't have a vaccine, and because therapeutics is still in the process of being researched of how to treat patients who have this new disease, our only methods are public health ones. Our only methods are good preventative public health strategies, because it breaks the chains of transmission. So, and if the earlier we do this, the absolute better. So if this person here has it, and then this person practices social distancing, or measures are put in place for social distancing, suddenly we've broken the chain of infection, or transmission, and they're not passing it on to other people.
So at the very least, what we are doing here, and if you have noticed that this is a wide angle shot, it's deliberate, because we are encountering this new phenomenon for us, particularly in Australian culture, where we are very handshake, how you go, and slap on the back, high fives, etc., etc.
Yes.
Social distancing means we need to keep 1.5 meters away to actually try and...
to reduce. At the moment, it's all about risk mitigation.
Right.
We can no longer contain COVID-19. It's no longer contained in Australia. We can still, though, make a difference with how far it spreads, with how many people have fatalities from this as well. And every decision that we make individually and collectively as a community will impact on the end results of what we see happen here in the Sunshine Coast. So social distancing measures, being mindful of those that are most vulnerable, shifting our focus from what's my personal risk to how can I protect the broader community, how can I protect the broader society and reduce the burden on our public health system, how can I protect and care for those who are vulnerable in my life, those who might have pre-existing health conditions, my parents who are aging. What can I do right now to show compassion and to be considerate and to be thinking about other people during this time? Because that's how we will see these chains of transmission stop.
And this is why we're addressing this, actually, is because we realise, particularly here in our local Buderim community and within the Goodlife community, we have a high percentage of vulnerable people. And this is not in any way self-preservation that we're talking about. Some of these decisions that we are having to make and have had to make are out of compassion and care for those in our community who are highly at risk. And so we want to continue to engage that care, but that care means we have to make decisions that are going to feel uncomfortable and even painful. And the reason being, though, because the graph that we've been seeing a lot of that deals with what's called the elongated curve or the flattening of that curve. What does that mean?
So bear with me a moment. So hopefully, I think there's been really good public health measures already happened. So hopefully what I'm sharing with most people won't be new, because I'm starting to see more and more people are understanding what we're talking about. But we are going to go over it, this curve. So at the moment, we can see that cases are going like this. And as we've expressed, and as we've already seen in Iran, in Italy, in other countries, you start with a trickle of cases coming in, trickles, and because of what we just showed earlier, suddenly that exponential growth is large enough that there's enough people that are now significantly sick and are able to be identified, and we get a big spike in cases. So you can go from, at the start of the week 1 case, the end of the week 1,000. This is possible and it can happen, and when that happens you get this peak, and then this is what we want to avoid. Because what happens here is you have your public health system has reached its capacity. And then suddenly anybody, because you have an influx of people all being sick at the same time, it puts a burden on our emergency services, on our ICU beds, and then you have unmet need here. So all the decisions that we're making now, and all the decisions that we make individually and collectively, it's not just up to the government. When it comes to public health, it's up to all of us to do our part. It's up to all of us. We don't just wait for the government to say you need to do this or you need to do that. We can all take a proactive approach, use common sense, and all our individual hand washing, our social distancing decisions that Goodlife are making as a community will all, absolutely categorically impact the height of this curve or how much this curve is flattened out. So what we'd prefer to happen, is for cases to come in slow and steady rather than all at once. We want it to be flattened so that unmet need is minimal or not at all. And the only way that we can do that is through social distancing, again, and all those extra hygiene measures that we all take, being mindful and considerate of those in our circles that are more at risk. So that's our only way of doing this. But, never, there's very few times in your life that you can really identify or see that your personal choices and our choices as a Goodlife community on a whole have the potential to create a cascade of events for good or for bad. And those cascades of events can be cascades in terms of chains of transmissions expanding and cases rising, or the opposite effect of being able to be leaders in putting in prevention measures and having a flattening out of the curve.
Yeah. So the only way that happens is this elongation is to realize that as it moves slowly, it actually looks that it lengthens the cycle of this.
Yes.
So if it peaks, and as we're seeing in China, they took really draconian, steps towards controlling that community. And I guess it's easier to do in a communist nation than a democratic free society. Yeah. But they are on the downside, but the cost was immense.
The cost was massive. Yeah. And we still won't know all the ramifications for some time. For us, sorry to cut you off there, but for us, it means it will go longer. Now, when we're saying longer, I'm hearing businesses saying things like, look, we're shutting the doors for the next 2 weeks and then we'll reopen. That's not a likelihood looking at this scenario. No. Wherever we end up, whether it's a high peak or a slow peak, this is going to be a long winter for the world. Yeah. From looking at every angle of not just impacts on health, but also what this is going to mean for global financial markets, for supply chains. So this is really a time where we have to be considered in our choices and be compassionate in our choices. And if we see a peak, it'll be we'll be over the other side a lot sooner than if it is spread out across the end of the year. But we're looking for 2, 4 months, 6 months. Yeah, wow. Yeah, and that doesn't mean that the steps that we take now are steps that need to be in place for the whole length of that time. Yeah. This is a period of time where we have data, but it's not a crystal ball. Yeah. We can make the best calculations, but we need to keep reevaluating, monitoring, keep updating our approaches, keep updating our responses, because it has to be measurable and it has to be sustainable. But this is the time right now where our cases are low that actually we need to step in and make significant choices to flatten the curve. And this is the time where we need to have a very fast response. Yeah. And so understanding that, and I hope listening to Jay has been helpful, but it also sets the bar for how we will respond as the Goodlife community. Following the actions that have been taken in other parts of the country, someone has to take the lead, and this is where it gets really hard for us. In Melbourne, decisions have already been made to close public libraries, arts facilities, public recreation facilities, pools, because we realize that the social distancing is not possible in those environments. This will come as a shock to many, but let me assure you, we are going to do everything we can to maintain our connectedness, our sense of community. But we have had to make the decision with a heavy heart that we have to close our Goodlife facilities down. That is one of the most painful things I can have to say. But looking at this, I have a responsibility as the leader and as the team leader, along with our executive leadership team, to make this decision. We do not want to lose connection. If you know the heart of Goodlife, it is not just a business. It is a place of hope, of health, and of wholeness. That we care for you as an individual. We care for the vulnerable parts of our community. We have so many people that fall into senior categories and so many children. We have so many with special needs, with disabilities that call this place home. And when we act with compassion, we must act in a way that validates their well-being. It's not good enough for me to say,
that anyone is expendable or is sacrificial for. We can't afford to say that. And so therefore we must make this call. We are following a precedent set in other states, responding to what is happening in their communities, but we have had to make the call to lead in our community. I believe we are positioned to lead, and I believe that you will see other places following suit in the near future. I pray I'm wrong. I know Jay has said that she hopes that these scenarios are wrong. But at this point in time, it looks like we need to take drastic steps to keep our community safe. We are going to continue to communicate. We feel like this is a valid platform for communication. We encourage you to circulate this information to those who may be affected by this decision. We have not made this decision lightly. We met for hours and hours yesterday as we were faced with this. We've tried to make small adjustments, and it may feel like, hold on a moment, I just heard something different yesterday. That is true. But the information is moving very quickly, and the situation is evolving very quickly. I do want to read something to you for just a couple of moments that was given to me, and I hope might give you a sense of just what it is that we are facing. This is from someone who is an intensive care specialist in a small city. And this is what they write, and I hope it may give you a little bit of perspective of what it means to take action now and the vital importance of that. Again, I'll read it. I am an intensive care specialist in a small city. Coronavirus isn't just like the flu, but it's only very dangerous to the elderly and to the already unwell. Quite a lot of people in their 80s will die, but most of the rest of us will probably be okay. If you're in your 70s and get coronavirus, you've got a really good chance of survival if I have a bed for you. If you're in your 60s and you have a heart attack, you've got a really good chance of survival if I have a bed for you. If you're in your 50s and need bowel cancer surgery, you've got a really good chance of survival if I have a bed for you. If you're in your 40s and have a bad car accident, you've got a really good chance of survival if I have a bed for you. If you're in your 30s and have terrible preeclampsia or a complication of pregnancy, you've got a really good chance of survival if I have a bed for you. If you're in your 20s and have a bad reaction to a party drug, well, you've got a really good chance of survival if I have a bed for you. I have 7 beds equipped with life support machines. We have a plan to increase to about 25. Getting more is not a matter of more equipment or more money. That bit is easy. There are not enough skilled staff. Even if we all work double shifts every day for 6 months, and we probably will. If 50% of my city gets infected, that is 75,000 people. If 5% of them need the support, which is the current estimate, that's 3,750 people for 25 beds. Let me reiterate that again. These figures are not just wild projections. These are estimates that are being made in the healthcare community. The impact on a community of 150,000 people is 3,750 people needing access to these support systems. There's 25 available. And then I may not have a bed for you. So it is up to us to flatten the curve. It is up to us to take every measure we possibly can this early in the equation so that we can preserve life and well-being. It is going to impact us enormously, and we're seeing it across the world at a financial level. That's actually the least of our concern. Our concern is you. Our concern is your family. Our concern is this community. Our concern is this nation. If you'd like to review what I said yesterday, I talked about 4 things: awareness, care, preparedness, and prayer. We are a people of prayer. We believe in a God who cares desperately about humanity and knows us in our plight and invites us to cry out to Him. We cry out to Him for wisdom, for peace, for hope, for strategy, for discernment, for recovery, for healing. I pray in this that you will stay connected. There are so many ways to stay socially connected these days, and we will use every one at our disposal to do the best job that we can. Jay, I want to thank you for your commitment to this community, for your heart for Goodlife, for your heart and your service to this nation. And I say that to you and so many others who are on the front line as we address what has the potential to be a once-in-a-century situation with dire consequences. And I thank you for encouraging us to take the action that we now in turn are going to engage. I respect you, and I respect all of those who are working in this field right now. Thanks.
Thanks so much for having me, Tim. And I just want to reiterate that, even though this is a tough decision, I think it's fantastic that Goodlife can lead the way as a faith community during this time, to create positive changes, to protect our vulnerable, and to care for one another using not just our faith, but combining it with the best research we have possible. Yeah. So Tim has just mentioned the measures that they are taking as a community at large. I just want to focus in on you as an individual, because it's, Tim is making very strong steps to help avoid the spread of COVID-19 in our community, but it's up to all of us to be a part of this. So for some of you that maybe you've been thinking, oh, this is just the flu, and then you might be readjusting your thoughts to thinking, well, what should I be doing right now? One thing that I want to discourage is stockpiling. That creates other stockpiling of food, or as you've seen, toilet paper, or whatever it might be, as that creates other problems. I think it's totally fine if you're putting an extra few bits and pieces in your shopping trolley when you are doing a shop. That's fine, but just try to avoid anything that's panic. Come from a place of preparedness, not panic. Also, I know that public health specialists all over the world keep saying the same things, and I'm going to repeat them. Wash your hands. If you're washing with soap and water, sing happy birthday to yourself twice, and then stop washing your hands. Use alcohol hand sanitizer if you're lucky enough to have one. Practice social distancing if you are going out and about. Just keep your distance from people. Just try to keep about 1 metre apart. That can be very helpful. Other things that you can do is stop touching your face. I know that's a message that's been shared as well a lot, and it's really difficult, but keep practicing it. It's all about reducing your risk. It's all about reducing probabilities of transmission. And for every measure that we all put in place collectively, they add up and can create, big changes. So just want to encourage you to be well researched. Read government websites, World Health Organization, CDC. Try to avoid too much of what's sent out on social media, and think about your mental health and the mental health of other people around you as well. Like I said earlier, we need to be compassionate and considered in our responses. We need to be thinking about the other. We need to be thinking about how can we love each other right now creatively during this time. So you can still reach out on your phone to those who might be vulnerable. Give them a call. Is there anything I can do? Can I do the grocery shop for you, Mum? There are simple things that all of you, and it's different in everyone's context, but I encourage you to start thinking in these ways. I just want to touch on really quickly who are the vulnerable right now, because they are our primary focus as a Goodlife community, but also as a national response. This is our focus. So as your immune system weakens with age, we can see that as age goes up, the risk of complications for this disease also go up. So especially once you're over 70, 60, in each age bracket, we can see that it goes up. That's not to say that we should avoid people in those age groups. It means that we need to be mindful. So, you know, this isn't the time to go visit nursing homes. This isn't the time to, if you're unwell, to go visit elderly people. This is the time to call them. This is the time to be thinking about, okay, how can I support those in my family that are in this more vulnerable category? Also, for yourself, or if you know anyone that has already pre-existing health conditions, this includes diabetes, respiratory illness, cardiovascular disease, high blood pressure, and also cancer, that also places you in the more vulnerable category. This isn't to scare or alarm anybody. This is because we want to protect you, and we want to do what we can as a community, again, to support you during this unusual time. It also doesn't mean that if you have a pre-existing health condition or if you are elderly, it's not a death sentence. So I just want to make that really clear. It's not a death sentence, but it's about everything that we do on a big scale and an individual scale actually reduces the risk of death, reduces the risk of infection, reduces the impact, the everyday impacts that will be as a result of this disease, this unknown disease that is spreading in our community currently. So just really want to encourage you to be thinking considerately, compassionately, creatively, put in place those simple, good public health measures. Cough into your elbow or use a tissue, throw it in the bin. Don't touch your face, wash your hands. You're going to be tired of hearing these messages, but we will keep saying them and we'll keep saying them in a variety of ways because you will be making a difference in the fight against COVID-19 in our community. We all make a difference and you're a part of that. So thank you. So
do stay in touch. And we will be in touch with what our next steps are. But as of this week, this centre will close down by Friday afternoon, and we'll adjust as we go ahead. God bless you. Thank you.